Thank you, Dr. Good morning, everyone. I'm Dr. Bengaluru. I'm from Assistant Professor at the Division of Medical Informatics. We welcome you all to the third and the final day of the annual PORTENT meeting. I hope you're all rested, and we have an exciting list of activities planned for the day. We'll start the day with a lecture, followed by a hands-on session by Dr. Verghese on the usability testing to facilitate product design. Dr. Verghese is an assistant professor in the Division of Medical Informatics at St. John's Research Institute. He's also an associate at the Lakshmi Mittal and Family South Asia Institute, Harvard University. He has held diverse roles in academic research, public health, and health program management across India. Currently, Dr. Verghese conducts research in digital health and teaches design thinking and systemic design for healthcare. I invite Dr. Verghese for the dais. Please give him a hand.
Okay, good morning, everyone. Thank you so much. I'm just going to get my slides up. It's been so good in the last 3 days, last 2 days, sharing some time with you. And I think from the first discussion onwards, I realized in some sense I'm preaching to the choir. So some of the concepts that I'm going to kind of highlight have come up already in our discussions from the lightning talks and things like that. Some of this I've called this principles of practice, and I'm going to talk about a certain method and approach for refining our designs and our devices. And some of this will be kind of high, very principled. Some it will border on philosophy in some sense, according to some people, and to get to the heart of what design really is. And some of it will be our experiences in practicing, trying to implement some of those principles in a real-world context, in resource-constrained settings. So there are different ways of doing design research, and it depends on the context that you're in. The kind of technology that's available for studying some of these interactions are not available so cheaply and available in our context. So what I hope is that if you can take away from this is it's possible to really get into the depths of understanding how people interact with our devices without spending too much time and spending too much at not too much cost. So first, I'd like to just delve into our team, right? So this is our team. You've noticed different people sitting around, and it's basically through our experiences in taking different kinds of solutions, mostly digital. We are an informatics department, mostly digital solutions, and through the experience of understanding the interactions that our users have, we've been able to come up with a certain body of work that I could be sharing with you as we go along. So about Dr. Tony, Tina, Ryan, Justina, Abba, yeah, and okay, basically all of us. You've seen this around. Just to say that this is really a team effort. There have been a few people who've moved on, who were some of the more poor people who moved out of the team. So I'd like to acknowledge their work as well, their contribution. So we're going to go into why are we going to do usability testing, and in that I'd like to highlight the principles of design inquiry. So already getting a bit abstract, design inquiry, and then with that, after that, once I've convinced, I don't think I need to convince any of us so much that these issues need to be looked into. Perhaps more from the technology side, people over there. But what I might be able to do is give you a few new frameworks to inspire the kind of usability inquiry that you might be doing. These are not new frameworks; they've been around. It's just that they're not really talked of too much in biomedical schools. So I'd like to just introduce you to some of those, and then after that, I'll go into how the practice that we've had, some of the learnings, some of the techniques. The thing about design is that it doesn't really fit into anyone's box. It is extremely contextual, as it's about building the ultimate particular of something, your particular device that goes to a specific user in a specific context. So the methods that you use to explore that interaction are also specific. So I don't want you to say that, okay, these are the steps you have to follow so much, but maybe these are the principles and these are things to keep in mind as you take these devices to users. Okay. So I'll start out this story. And the question is, why do innovations fail? And anyone working in the global south is aware of this. Dr. Martin and Dr. Agre talked about, how does something fit into a clinical workflow? How do you get a device to fit into a clinical workflow? So this story has been repeated again and again and again over the decades, ever since, I think, the end of the World War II, when there was a lot of economic development and rebuilding, and some of that came our way from the global south, from the north, and in the form of different kinds of development programs and aid programs. So that have happened. So this truck is called is a Bedford truck. It was actually so this truck is a huge Bedford truck. It's from the UK, from the 1970s, and this picture was taken outside the hospital where I did my residency at a community medicine department. So we called it the White Elephant, and it's a very apt name. So what happened was, in the 1970s, there was a honorable health minister of India, one of them, forget the name. He went over to the UK and he saw these huge, amazing, nice trucks. And he had the brainwave. Okay, why don't we bring these trucks to India, and every medical college can then take healthcare services to the community point of care, right? You go shift your clinic to the community in the form of mobile clinics. And so at that time, there were only about 60. I know all this because I got the story from the professor who was there at the time it was implemented. So there were about 60 trucks, Bedford trucks, imported into India and given to each medical college. And I think only 2 of them actually used the trucks. So in Vellore, where it was deployed, what they found was that the trucks were too wide to get into the village. So the gullies of just the access into the village, the truck couldn't get into the village, it had to park outside. There were a couple of villages that even cut down trees to widen roads to get the truck in. And when it rained, it got slushy, and the truck was heavy. It wasn't built for those roads. It would get stuck. So we realized that there's, and again, and we see this happening again and again, where something that's been designed or conceptualized in one place doesn't fit into the reality of the context where it has to be deployed. We have been struggling with that on the digital front. And it's not necessarily north to south anymore. It's Delhi to everywhere in India. It could be Bangalore, an IT office, one of the ones that we passed by in our trips. Something that's conceptualized in an IT office that has to go reach a place like Medical, or even more distant than Medical, And so this gap between where it's designed and the reality it has to face and so Heeks in 2002, he put out a really important report, and he also went and specified more specifically in terms of digital and health information systems, how this gap between the design and reality, and he had a bunch of different dimensions. So because there's a design reality gap, a lot of the time, technology just fails. Even if you have the investment, even if you have the scale, even if you have the deployment, even if you give it to someone on their phone, it can still fail if it really doesn't if it doesn't align with the reality. The other thing is, so why does user context matter? And this we have to turn to systems thinking. So I'd like you to just think about the fact that we have a technology, and in systems thinking, the idea is that we are all part of systems. So a system is a whole that is constituted of 2 or more parts, none of which act independently of each other. So our devices, the outputs we get from our devices are not independent of the users. And really the output of our devices is a result of the interaction between our users and their devices. So there's no independent component in a system. Not only that, every component in the system has an effect on the ultimate properties of that system. So our users affect how the device is used. Our devices affect the outcomes for the patient, the environment. And as you go further and further out, the technology system and the healthcare system and the social system, they're all systems within each other. And you can go on and on and on. And if system thinking really is true, that means every single device that we design and we deploy and we develop has a wider and wider impact far beyond what we thought of. So you can take the physical environment to be the world. Even the technology that we deploy into space, in the vacuum of space, isn't in a vacuum because it's connected through signaling to mission control, right? So the truth is that there is no technology that exists by and for itself. All technology is a subsystem of a social system. That's just the way it is. The only place where technology exists for itself is like Skynet or the Matrix. It's science fiction. Okay, it doesn't exist in the real world, right? So why does user local context matter? Because there's so much interaction and interdependency between our users and our devices and the health system that happens. This is going to be a bit tricky. So why do our devices need to be intuitive? So we need our devices to be natural for our users to use. And I thought about why is that true? Why is it that we are getting more and more digital? We are getting more and more compartmentalized, thinking in terms of ones and zeros as the meaning of so many things. And this I got from Nelson and Stolterman, a really good book. I can't recommend it more. It's called The Design Way, and it's changed the way I think about design. So the concept is that if you look at systemic design inquiry, if you look at the situations in which our devices are deployed. So I've got an example here. We did a needs finding exercise with a bunch of community health workers in the government space a couple of years ago. And we asked them if there was any device that you could have, you can imagine, what would it be like? And so this Asha worker over here, she dreamt up a little, made out of Play-Doh, little device that would be nice and round and fuzzy and warm, and it would sit on a neonate's abdomen. So her challenge was that when she did a postnatal rounds of the village, the house visits that they do for every child that's been born, she wouldn't know. They might, they're supposed to do an assessment head to toe, and part of it would be, does this child have umbilical sepsis? So sepsis from the umbilical cord in the umbilical region. And so what she really desired was a device that could just sit on it and then light up. Sepsis sent before the patient's okay, just reassure the parents. So in that situation, there's all these things going on. There is the neonate and the potential for infection that they have, that the baby has. There's a nutritional aspect. There's the concern that the parents have. They have two concerns. One is that they obviously are concerned about their baby, but they're also concerned about that day's wages, work, taking the baby to a hospital and maybe getting admitted it takes a village to organize that and manage that. They'd have to depend on the community, the expenses, looking after this, looking after that, a day's wages, and all of that. So this is to say that the situation is extremely complex for a regular interaction, and it has different elements to it. There's economic, social, political, cultural, besides the biological, besides the pathological, besides the technological that we have. And all of these different situations blend together and interplay with each other. And so the health worker who addresses the situation has to say, okay, there's all this complexity, there are all these tensions. I need something to kind of cut through everything and give me some information, definite information that I can use to navigate this complexity. And for her, the device, the point of care device, would provide her the data, information, and knowledge that she would need to make a decision, right? And so from this analog situation of humans who are analog beings, of the situation that's a complex situation, of a village that's an analog place where, thousands of things are happening at the same time and different kinds of tensions, she needed this point of care devices. What the potential that they have to do, that they have to contribute, is to cut through all of that and give a person diagnosis, yes, or at risk, yes, at risk, no, which is extremely valuable. And that's what we do here, right? And that's what we work on when we talk about the validity of our, the sensitivity, the specificity, the possibility, the value of our devices. To what extent can it give you the right data, information, and knowledge? And most of our studies and most of our efforts go into that, and that is amazing. But there's another side to what happens in that situation, is that being an analog being, the community health worker, having all those complex workflows, this is where workflow comes in. Being a person who herself is got all these tensions going along, who herself has another child to visit and another child to visit, and another program to implement, and another program to implement. That data, information, and knowledge has to be fed into that analog experience that she has, the situation, as well as her own understanding of the situation. So the good thing about point of care, obviously, is that it is taking it to the analog situation that it's going to. But when the problem with digital devices and devices that have digital interfaces is that too often they don't really blend into and give a unified experience of the diagnostic process that has to be provided. So Nelson and Stoltenberg call this a principle of going from an analog situation to digital, and then incorporating that digital knowledge back into an analog workflow and experience. So it's from analog to digital and back again. And this is where user experience and usability really comes to the fore, because you're trying to understand that person's world, their context, the way they perceive the device that we're building as an analog being, and give them an experience that flows, that is unified with their workflow, that is integrated to their to everything that they're doing as much as possible. So that's the principle that we're looking at. So another example of this, these are both products by the same company, and the one on the left outsells the one on the right. So the more I think about another example of this, I used to have an iPod and used to come up, and it had this this flywheel on it to select up and down, and it always just made this tick sound, tick, 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 which kind of reminds me of the old phones that used to go ring, 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 and it kind of simulated an analog experience of something that hits you and you can hear, you can feel, you can touch, and it's not just a few pixels on the screen. Similarly, the kind of when we talk about bringing the digital into eyewear and into what people are seeing, what sells more is something that is able to take digital information and integrate it into the reality that people have, rather than creating a new digital reality for that person. What people would rather have, in terms of what's being sold, is something that integrates across. So why usability testing is to make our devices intuitive to people who are analog beings, right? And why do we need to do that? So to address the interactions that our users have with the environment and the users and the devices. And why do we need to do that? To ultimately overcome the design reality gaps that we have. So that's pretty much the why. Okay, so what is usability? Fortunately, there are standard definitions for all of this. And I lean heavily on the International Standard Organization for some of these. So the concept of usability, I think it's first book first kind of experts came together. There's the last one was in 2018, ISO 9241. And usability is the extent to which a product can be used by a specific user in a specific context, with specific purposes, goals, in specific context, with effectiveness, efficiency, and satisfaction. And so that's what we use. And we now know that, I mean, as mentioned in yesterday's regulatory topics, it's become part of regulation, device regulation. It's also part of electronic medical record regulation. So the office, the ONC in the US that kind of says that, and that allows people to deploy electronic medical records, mandates usability testing, what they called it user testing. So that's the overall idea, is that we want to investigate the extent to which our users can use our devices efficiently, effectively, and to their satisfaction. So efficiency and effectiveness are very easy metrics, not easy metrics, but they're metrics you can measure, they're hard metrics. The satisfaction is much more affective, it's emotional. And you have to get into the kind of psychometrics of it to really get into it and take a good measurement. So what are usability tests? In some places, in some people, and I hope you weren't thinking this, the idea of a usability test is any method that tests usability. That's not what I'm going to take us through today. I'm going to take what the Americans more specifically call user tests or user trials. I don't like calling them usability user tests because, well, first of all, people don't like being called users. That's, when you approach someone. The other thing is that we're not really testing the user. The distinguishing fact of this methodology is that you have to use a user rather than an expert, rather than a scientist or a technician. You have to use a typical user, which makes sense. But the thing we're testing, the thing we're investigating is the usability of whichever device we're thinking of. And so I prefer to call it usability test. What I've noticed is that basically towards the, I think the European, the UK side of things, they call it usability test, and potato. And on that other side of the Atlantic, they call it user test or user trial, potato. But anyway, so for the purpose of this, that's what I'm talking about. So it is a research technique that involves using representative users, and you investigate the usability of that product. Those two things need to be there. Besides that, there is a whole bunch of ways that you can do it, and it's important to be creative in figuring out how our methodology is going to be for doing this. I'll just show you a couple of examples of some of the things that we've done. This is just to say that if you look at the overall design process where you're planning a human-centered design process and you're trying to understand specific contexts of use, there are many different methods that you can use. To place, so things like participant observation, contextual interviews, discussions, generative design research, where you're trying to look at what it is that people value and things like that. When you're really looking at studying people's needs and needs assessments. Once you've come to a point where you have come up with a concept of what needs to be designed to meet the needs that you've, or to fulfill the desires that you've elicited, you then need to evaluate that design. So that's where usability testing comes in. To some extent, it's evaluatory. It can also be more exploratory. And I think our personal feel is that you have to do both. It's not ideal to just use it to benchmark your device. The real value is in getting insights from users on how to integrate your device, how they understand your device, their mental models of your device and its work, and their understanding of how this fits into everything else that they're doing and all their stakeholders and all their processes. That's basically formative. So you've got summative, which is like benchmarking, and it's important for safety. You also have formative, which is more for gaining design insights so that we can refine our design as we go. Now, obviously, your product, if it's nearly finished, the value will be less. You ideally should be doing this on prototypes where you have specific questions, design questions that you want to change. So, yeah, just to say again, it's very important. There are other techniques for doing this evaluating usability through experts, things like heuristic testing and things like that. But this is specifically with users and to investigate the usability of a product. Besides those two things, there's a lot of variation that you can put in. Okay. Again, so another thing about this is that this is design research. It's not necessarily, it can be scientific, but it's not for the purpose of science. So the philosophy of science is that we make observations to test hypotheses, to come up with ways of explaining what we observe about the world and how it is. So you go from a particular situation observation up and you abstract up to principles, which you apply in engineering and everything else. But you're abstracting up towards absolute truths. Towards, I'm not saying we'll ever get there. What we are doing here is we are making specific devices for specific situations, for specific users. And so we're moving in the other direction, which is to make an ultimate particular. And obviously it's a spectrum as you go from one thing to another. And we've seen from MallBio yesterday how the same device has so many different kinds of applications and different kinds of processes that it can be integrated into. So we're going to something that is more real, and that's what we're heading towards, rather than something that's more generalized and abstract. The real value of this process is to design something real and have it in front of us. Okay. Right. So a word about LFAs and interactive systems. by the way, during this lecture, in the middle of it, we're going to try and do a little bit of human-centered design thinking as well. Those are the sheets out in front of you. So when I notice that many of you are just yawning, then we'll take a break and we'll see if we can do a little bit of a few thought experiments on the papers in front of you. Right. So about interactive systems, we have been working mostly in digital. I know most of us work with some sort of a device that uses chemicals and things like that. And I was thinking about how this could be relevant to you. So obviously, if you are evaluating a device that has a digital component, like the screen that comes out, or even something like the user manual that needs to be interacted with by a health worker, or those are things that you can study the interaction of. If we're talking about just a regular LFA cartridge with 2 lines on it, I still believe that is an interaction. Unfortunately, because it's become, at least in India, the almost everyone understands what the strip means. There's a mental model that's been established. This is when the technology came in. But it's still an interaction. So I remember April 6th, 2015, when I saw this and my life changed forever, right? And that is an extremely significant interaction that you see. It's still an interaction, those 2 lines appearing. So I just like to encourage you, even if you're dealing with something that's more chemical based, there are still aspects to that interaction that your user, that your stakeholders, that your beneficiaries, that the patients that you're dealing with interplay with the device that you have. Okay, so who is a good usability test facilitator? We call it facilitation, other people call it moderation. It's up to you. I prefer the idea of facilitating and discovering. So first of all, if you're going to get into this, you should be familiar with the principles of user-centered design. Ideally, should be there in your mind. Just the basic principles, the approach, because it's a method that's steeped in that. The person who's facilitating should be able to gain instant rapport, be a good listener, be empathic, have a long attention span, good communicator, excellent memory. This is not a shopping list from my wife to me. This is actually from this reference book, Rubin and Chisholm. Okay. Because I remember the last time I was reading all of these things at one time was our first date. And that gives you an idea of what it's like. You are looking for a relational interaction as a facilitator, actually. The other thing is, once you've got your insights and you've done your interaction with your user, you also have to be a big picture thinker. You have to think systemically. So like we were talking about, how does this fit into the awareness side of what's happening in the community? How was my device that was raised on the first day? Do we need an awareness? Do we need an awareness campaign as well as this device? Or have we done the awareness campaign and we need to catch up with the product of that and help our system to catch up with now the increased demand that our awareness campaign has brought in? You need to be comfortable with ambiguity because people are so complex. And what people say might be one thing, what they do is another. The other thing about this method is that we are really trying to give a person an embodied experience and take a peek into their mind beyond what they say by how they behave. So we give them an embodied experience of a device. And then we don't ask direct questions about the device as such, but we might, after they've had that experience, we then ask them about the experience. So it requires you to be a bit flexible. What I'm saying is, this is not something that you can just give a person. It's not like just giving a person a questionnaire and saying, do you find X, Y, Z? Do you believe this? Otherwise, we just give them questionnaires, right? But anyone who's worked in this field, you know that besides the biases that happen, there's a lot of people aren't so self-aware of how they interact with things and how they feel about things. And they're certainly not so ready to come up and give you a really accurate representation of their state of mind when you talk about it in the abstract. So we need something that, we need a process that will actually kind of hunt for insights, psychological insights, beyond what might be apparent on the surface. So I like to think of it in terms of indie, in the Greatest and Lost Art. you really have to have the mindset of a treasure hunter. You're searching for something. You're not just trying to tick off boxes. We're not just trying to um, gather data and all these things like that. You really have to be flexible and think on your feet. And every user test you design might be very different from the other one. And you have to draw on a certain amount of creativity to find out how to be creative for your user. Just designing these things itself is an exercise in creativity. Okay, who do you include in a good research team? So fortunately, like I said, showed you our team, and all our learnings and things like that have been because we have very diverse perspectives. Yes, we're all Indian, but we all come from different states, which is great. We don't speak the same languages at home. We don't have the same professional backgrounds. Some of our tests, we brought in the product developers and get their perspective. We've got clinical data scientists for AI products, get their perspectives. And the idea is to get divergent perspectives. At the same time, everyone needs to be motivated for the same. There needs to be a common human-centered principle running through, that the focus of this endeavor is our users and the wider system that they have to exist in. Okay, who is a good participant? So the ideal thing is to get, you need to get someone who's representative of the target audience of our product. That's basic. Now, depending on whether you're trying to measure a metric or you're trying to gain design insights, you might switch between random sampling and purposive sampling. And you ideally want someone who's, especially if you're going purposive, you're looking for someone who's proactive. At the same time, some of the times, like we've run in trouble before because we've thought of designing a product. We've gone to a group of people who seemed to be typical for us, a group of women, and they were fine. But then, and we ended up designing the product. But then when we went to the community where we had to deploy, we found that there was a big gap in digital literacy between the people who finally had to use a product and the people we designed with. So you never know when finding the right kind of person is actually more challenging than you think. So what are different types of bad participants? There's obviously no bad participant. Out of about 150 that we did for one project, user tests that we did for one project, there was one participant who we did a kind of a before and after. And there was one participant who was very cooperative and very helpful. But the second time he came around, he basically was very evasive. And instead of allowing us to use it, get his insights, he would just insist that we would do all his health work. So this was a specific medical officer at one of the centers. And when we asked him why, he said that he felt that we were part of some sort of a drug company trying to develop their own product, even though we had already explained everything about who we are, why we're here, what the benefit is, who's sanctioned this, all the permissions. We show them all the letters, we show them all the official stuff, but he still didn't believe us. So that might happen. But it's, for us, it's only 1 out of 150. The other thing is that people who you might design a test, ask a person to go through certain scenarios. So in a usability test, basically what we're doing is we're setting up a kind of experiment where we have our device and we ask a person to use that device. And as they're using the device in that scenario, we observe them and look at what they're doing, and we observe the interaction and we study it. Ideally, if it's a good device and it's very usable, they'd be able to finish that task pretty easily, pretty quickly. But because people aren't the way we expect them to be, and because the whole reason why we came out of the community was to find out what were these differences in perceptions, very often it goes wrong. In the sense that it doesn't go wrong, but obviously our device isn't as usable as we thought it was. The mental models that are at play, the way people think, the way they perceive, either our device or the symbols on the screen, or even the terminology that's on the screen, even the terminology that's in the instructions. It might not be the way they think about it. And people who are really bad, like who obviously can't complete a task, are very frustrating to do those tests, especially if it's something that you've built yourself, but they're actually the best participants. So to give you an example of that, so we were with a community health worker, and we were designing a digital platform, which was a smartphone-based platform. And this community health worker told us, I mean, it was something that the platform was already deployed for every one of them to use. She was in the mid-40s, and she came onto the program, started working about 20 years earlier, where all there was keypad phones, right? Feature phones. And what we discovered was that there were community health workers, and she was a typical user. She didn't really understand the concept of drop-down menu. That if we asked her to find out, if we gave her a screen and asked her, can you tell us how many people are in this village? And there's a field that says village, arrow down to choose a village, which obviously, all of us do use in all our apps. So saying, where's the village? Where's the village? Where's the village? I can't find the village. And so what we realized from that interaction was that the level of digital literacy that we were pitching at 2 years ago was so far away from where it was. And that the insight from that, the insight from that really gave us insight into a much, much deeper need, which is we are going digital, we are getting all this technology, but there's this huge divide that's getting wider and wider and wider as technology progresses between people who are able to use it, have the skills and the literacy to use those devices, and people who don't. And unless we address that, the digital equality, the things that we're trying to, the things we're trying to achieve in terms of bringing healthcare to people will not be achieved because those devices just aren't accessible to them. They can't think through them. In other words, we're actually increasing inequalities rather than reducing them with all the internet and mobile phones that we're using. So some of the deepest device insights come from people who are really bad at completing our tests. Okay, just a warning, if you are going to do this, try not to do this on a device that you yourself have designed. It is extremely, extremely painful. Speaking from personal experience. So in our tests with the digital platform, we had the designers come along and they had to just walk out of the room sometimes. They're just getting so frustrated as we were interacting with the community health workers. And obviously there are biases involved. So as a PORTENT team, it's good that, you haven't, it's not your device in a sense, it's a different company that's making the device, and you have enough buy-in to make that device, want that device to work and test it very well, but you have enough objectivity to evaluate it and be open to the blind spots that the manufacturer, the designer might themselves have. The way we work up, if we are ourselves designing a device in our, designing an app in our team, we also have to face this issue. So sometimes we split the work where the person who does the design research and the person who does the design practice are two different people within the team itself. And then for other projects, they switch over, that kind of thing. That's one of the things that we've used. Okay, so when do we do usability tests? If you think about what goes into bringing one of these products into life, you start with the fuzzy front end of design, which is going all over the place. You're trying to find what is the problem we're trying to solve, what is the context, what are we doing? And then you start to form ideas and needs and concepts and come up with criteria, and you get a prototype. So at the earlier stages where you are trying to make design decisions about your prototype, that's when you want to do formative tests, which are much more qualitative in nature. And towards the end, when you're looking for regulatory approval or you're looking for benchmarking, are we going to go with this device or not before you send it for manufacturing, then you're doing more of summative. Just one thing about managing time is that it takes managing a time, it's quite difficult sometimes. And in the healthcare space, we don't have the luxury of not all the time or regularly pulling people out of their work and spending as much time as we'd like with them. So sometimes you have to be flexible in terms of what components of your test you prioritize and actually conduct with the user. You might have come with maybe 3 tasks to be completed. I want to see if my user can, load the machine properly, or they can interpret the results properly, or they can feed the results into the other system properly. But if that health worker is busy and that doctor gets called for something, then you will have to just cut things down. So that's about access to them as well. Another thing about time is that it always takes longer than you think, especially in terms of qualitative. Getting those insights together, working as a team, always takes longer. Okay, so where to do usability tests? I'm told I haven't been to one, but I've been told, and I think if I bothered, I'd see it on YouTube. user tests in the global north, the west, you have these labs, right? Where you have in a design faculty or something, where there's a computer, there's a user, they come and interact with the device. The team is sitting outside somewhere, they're watching from screens, they're watching from cameras to watch the person's reactions as they interact with whatever device it is. And everything is being screen recorded, and you've got timestamps. The person pressed this button at this time, the person pressed that button at that time. We don't have any of that. So we do everything pretty much bootstrapped. So we can't even call our field workers in for testing with them. We won't get access like that. We have to go out to them and do the test in the field. So this test, actually, the reason why we're doing it outdoors is because there wasn't enough light indoors because it got late and the lights had gone off. And this is the tube light outside the health center. Obviously, increase the brightness. So you have to be a bit flexible, and you have to be. But what I like about these kinds of tests is that we are much closer to the complexities of the situation, rather than taking a person outside and trying to help them imagine how they would work with our device in a new situation. They're able to see the limitations around them. They're able to see that the electricity goes off. They're able to see, they're reminded of the process that they have to work through. And then they give us responses to questions we ask, which I find quite useful. Okay, so how to design usability test? I don't think, I've just got 5 more minutes, so I don't have time to really, if we have a bit of time, maybe we can do the sheets in front of you, or you can just take it as homework. I know it's supposed to be hands-on, and I promised you we'll take a break, but I'm afraid I'm just going to go for the last 5 minutes, and so that we can move on to the next session on time. Is it till 10:15? 10:15. Okay, so maybe I'll finish in 5 minutes, and then we can try the exercise. But roughly speaking, and again, this is design. It doesn't fit into any specific box. As long as you're going with users and you're giving them an embodied experience of a device, then you're on the right track. A couple of things that we found useful is going through this process of understanding it from their terms. So what is it that a user, rather the health worker, in our case, most of our devices, or the patient themselves at home, is trying to achieve? What is their goal in using our product? Not how have we designed a product to do, what have we designed a product to do, but what is it that the participant in real life wants to achieve, and we hope to help them achieve that with our product. Ideally, it would be exactly the same as our device functionalities, but we have to try and think about it from their perspective as well. And then try and think of a situation, real life situation. So this is why it helps to have a bit of a medical background, a bit of a community health background, if you're doing community health. We all have family at home, and we all have, to some extent, we have different kinds of point of care devices at home, and we have elderly that we're looking after, children that we're looking after. In that sense, we can imagine what it's like to be a patient. But if you have someone in the design research team who speaks that language of the health worker and who understands the flows and understands the context of what happens. So something like when you're designing a medical record in an Indian context, designing something that requires 10 minutes to enter data is not feasible. A patient might wish that the doctor had 20 minutes to spend with them, but the reality is closer to 7 to 8, 10 for extremely patient doctors. In most of our health systems, even on the private side, it goes to maybe 3 minutes, 2 minutes. So being aware of that situation, that context, is very important. Then we come up with a design research question. In science, we talk about scientific research questions. It's kind of the same thing. It's more analogous to the objectives of a study. So for this usability test, what is it that I want to find out about the interaction that my user has with my device to help them achieve their objective, or achieve their goal? So what is it that I'm trying to learn from this test about the interaction that my user has with my device? Okay. And all of that is grounded in the fact that they're using it for a specific purpose, for a specific goal. So that's where the design research question comes. And that determines pretty much all the rest. From that, we decide on tasks and specific things that you'd like to test them doing on your device. And it's important to break down those tasks, at least mentally, on paper in a task analysis, hierarchical task analysis, usability engineering. In terms of, so you understand all the different pathways that a person could use to get to that, to completing that task. And then there are things that as you are watching them complete this task on your device or on your app or whatever it is, things that you really want to observe and test and see, do they like it? Are they able to do it? Where are they getting confused? Where are they getting, where are they having problems? Where are they making mistakes? Where do they think they're doing the right thing, but actually they're doing the wrong thing, right? And things like that. And with that, you're going to have instructions for them to read and understand what kind of situation or what kind of experience you want to take them through. And it has to be understandable to them. Or the person who's facilitating needs to be able to say it in a language, it needs to be translated into that person's language. And the person who's facilitating it needs to say it and communicate it in a way that the person at the receiving end understands the instructions. So if they're not able to complete the instructions, it's not because they misunderstood the instructions, it's because they misunderstood the device. Okay. And then obviously things that you're going to look out for in interview questions that can happen after you've given them that experience. So we don't go to people in terms of the device and ask them what, how do you feel about this device? You give them an experience and then you double click on it. As you're watching them doing things, you then double click on it. And then finally, what is the kind of situation that you're building? What kind of, patient XYZ, basically clinical cases that help to build the situation. Okay, it's important to pilot because you never know when your design itself for the usability test is far away from the reality of where it needs to be tested. And it's also important, obviously, to have a working prototype for that. Access to participants in the global south is very regulated. In India, it's very regulated, and there's a lot of bureaucracy around. And I know we have people from government here, so for you it's easier. You face this, but the rest of us really struggle. And sometimes 50% of the work and time goes into the emails and the calls to certain government officers. And it's about the relationship, finally. I think that's what I would say. So we have people on our team who are expert at maintaining, at engendering and then maintaining these relationships so that we see them as collaborators and we're doing a lot of this work for the health system that they are a major stakeholder for, but we are also doing it so that they allow us and trust us enough to access their health system, their health workers, and use their time. And so we need to, in a sense, get them on. Obviously, you have to get them on board. It's not just about getting their permission, but getting them on board. Because once you have the results, are they really going to listen to them or not? So again, in the East, so much of it is about the relationships that we have. And that takes persistence, and it takes a certain amount of flexibility as well. Creativity as well, in terms of managing those things. Okay, we're not conducting. So I think Bharat's wearing the same shirt. Okay, or something similar. Anyway, so it's key that you engage your participant properly. And from here, we've done it, and then I've just realized that we were doing things that people have written about. So just giving you the theory that goes behind it. When you're engaging a participant, you've already got the permissions, you've got the time, you've called them up, you've got the time. So this is a medical officer sitting in a PHC. And she's finished her OPD, but she's still in the PHC. And the idea is to initially introduce established context, build rapport. Like I said, you need to have instant rapport, right? Instant rapport with your participant. And in a sense, that's why it's easier to do this, I feel, if you're used to clinical interactions. Because we are trained to talk to someone and get information from them and be their friend for 10 minutes and then move on, right? You're trained to go to people and try and establish rapport, especially the psychiatrists and the psychotherapists. So it helps in that kind of situation. But the idea is you want to enter into a conspiracy with them. So it's not you versus them. They don't get your design. You are the designer. Why can't you get it? It's not that. It's together. We're going to breathe together, and we are together going to have this common goal of achieving this common thing, which is obviously, better health, which is a better design, which is your inputs, your actual inputs. Try not to worry about whether I'm testing you about, this is not an exam for you. So when we go to our participants, we always tell them, we are not here to test you, which is why I don't like to call it user tests. We are here to test the device. We are here to test our app. We are here to test whether it fits, whether you like it or not. And very much it's like a teacher-student relationship where we are the students and the other teachers. So that's something that gets bandied around a lot. But I like the concept of breathing together. Conspiracy, it also means with someone, breathing with that person, being on their wavelength. And that's what it is. And then in terms of positioning, I just started to realize this together. In a conversation, the word comes from the Latin con, obviously with, and verte, to turn. So if you notice here, Bharat is actually not facing her and not even on the side, but with her facing the app. So we turn with them, both mentally and psychologically and relationally, we turn with them to together face this new device. Now, obviously, when you're doing an interview, you're facing each other opposite. But when you're doing usability test, ideally, in our context, is what we found. It works best when both physically are facing the same direction and looking down at something. And so that's a design principle that's come from Nelson spoken. Now, there is a place for questions at the beginning of the test, and it's really about having a common vocabulary. So this is a screenshot from one of our tools from the test I was showing you before. And we were trying to test about whether our users could use QR codes to search for patients. And we were talking about the same kind of women that, which I showed you, and people who are more, slightly more qualified, higher experienced, higher educated as well. But we didn't know, we didn't want to assume that when we said QR code, they understood what we meant. There is no Kannada word for QR code. It's a Q, which is an English letter, and an R, which is an English letter, and code is an English letter. But you'd be surprised how many English words have meanings in our languages that are different from English meaning. Okay, so we use the same sound of code, but the meaning of that term might be different in Indian language. So I'll give you an example, and it varies across the country. So in a mission hospital in Madhya Pradesh, where I was working at one point, latrine meant passing urine. Latrine, the latrine. And bathroom meant, defecating. Those were English words used in Hindi with different meanings. Okay, so just be on the alert that the terms that you use, as it's understood by your user, even if it's in English, even if it's in a common language, it might be understood differently. So it's helpful to get that common language sorted out at the beginning of the test. So begin a dialogue, through the words come together. So this is what we had. We said, so we wouldn't say, what do you think a QR code is? We wouldn't do that. We showed them a QR code and said, okay, there's this. Have you seen these around? And yes, by then it was just post-pandemic and, they started popping up everywhere. And we said, do you know what this is? What do you call it? And they said, yes, I call it code, or I call it barcode or something. And that's the term we use when we refer to it during the test. And we ask them questions. Okay. Yeah. Okay. So conducting usability test. Again, you need to be flexible, you need to be interactive. So what we set up was not just a person comes and we ask them to use the device and we see whether they use it. We set up a clinical encounter. So the associate on our team member over here is role-playing a patient. And this is the community health worker who is interacting with the patient and trying to pull out their record. So we wanted to investigate, how do people actually search for patients in digital devices? What is their mental model of how I need to search for patients in my apps? And we could have just asked them the question, but again, the idea behind usability testing is to test through an embodied experience. So we wanted to simulate the clinical encounter experience as well. And so we brought, one of us played the role of a patient, and so we'd asked the community health worker, this is our teammate, Dr. Abhijit, who was here before, and so he would facilitate the session, standing beside the patient, the participant, and he would say, could you try and, okay, here's a patient who's coming to you. We're not going to tell you what to ask the person. Could you just try and pull the record out from the app? We didn't say search for name, search for phone number, we didn't tell them whether they had an ID card or not. It was up to we wanted to see what the participant would ask for, what kind of information they would elicit from the pseudo patient or fake patient, as it were. And on the other side, we have a product manager over here, and we had someone from the professional design team, the prototyping team that was over here. And they were also watching and observing this whole experience. So this was part of one of the projects that Dr. Tony had mentioned, where we looked at this, optimizing one of the national platforms. We did about 140 tests for different kinds of things at that point. One thing that you hear the designers talk about is think aloud. So while we ask the person to use our device, we then ask them, can you just verbalize what you're thinking? And you watch them very carefully. And if they're not saying anything at all, well, you notice that they're struggling. And then you note that down, and we would say, okay, just after they finish the task, we'd ask, we noticed that you were struggling at this point. What was happening? What were you thinking? But apart from that, you ask them to say aloud what they're thinking. And so that gives you your notes of what they're feeling and things like that. Don't go into heavy questions, but just ask them to see so you can observe how they're going. And the important thing is to, I think Dr. Nitika talked about the 5 whys in terms of getting down to something. Well, when you're testing, you also need to be constantly asking yourself, why are they doing that? Why are they doing that? What are they perceiving? Why are they doing that? Why are they choosing that? Why are they, why have they written down that value instead of the right value or this value or that value? And the reasons could be multiple. So you have to be open to anything. It could be a terminology in your interface. It could be the batteries aren't working properly. It could be the eyesight isn't very good. It could be, there's all sorts of reasons that could happen. So just to give you an example, in the same search, the same day actually, as these tests were happening, we had a bunch of medical officers come in, and we asked them to do the same thing, search for a patient and tell us, find the correct record in the app. And obviously, when it comes to digital, the younger people are better at it because they've grown up with those devices. It's right. So the young people are better at it, but the person who couldn't complete this task was the person I considered, or we all considered, the most qualified and the youngest and the brightest person. So she tried to search for a patient and she just couldn't find it, to the point that we thought it wasn't in the back end of the prototype. And I kept on thinking, why didn't this work? Why couldn't she ask it? And then I played back the recording of the interaction. So what we do is we don't have recordings of video of the person. We just do a recording of the screen. And I noticed that in her interaction with the patient, she clicked a filter that filtered out the desired patient. And the reason she clicked the filter was because she asked the question, because our interface allowed her, it showed like different filters. And one of those was a risk score. And her question, while she was trying to find the patient, was, what is your risk score? Is it 7 or more? And the participant, which was basically a team member, had forgotten what the risk score was, which is what you'd expect a patient to do, right? And he said, yeah, it's 7. It's like, he just kind of said it, said the wrong thing, basically gave the wrong answer, not deliberately, but out of a sincere confusion. And what happened was the user then, the participant then selected out the desired record from the interface. So there was no way she was going to find the right patient. So for us, that helped us to understand that you couldn't really have these variables in filtering that people could get wrong. Either the user themselves could get wrong, or the person that they're trying to get the information from wouldn't give correct information. So we just took that out of the design completely, that kind of thing. So when you're talking about a source of error analysis, you need to get down to the root of why it is that something went wrong in this task. Okay. So how to make sense? There are quantitative metrics as you get closer in terms of efficiency, effectiveness. So a couple of tools that we like using. The stats on this are not that complicated. There's not like, it can get, but for most of the tests that we need to run, it's very simple key tests and things like that. And this book is really useful if you want to use it. It's called Quantifying the User Experience by Soren Lewis. And they've gone a step further. They've made a website. So if you're thinking about doing usability tests, I highly recommend trying out this website called measuringu.com. Now, obviously, they've commercialized it into, but they've put enough freebies out there for any investigator to use in terms of sample size calculations, in terms of feeding in your task times and getting a statistical outcome and a p-value and things like that. In terms of making sense of usability tests from qualitative insights, I would like to suggest to you the best method is affinity diagrams. It's come out of the design research world. It's called KJ method. Social behavioral scientists like to think about reflexive thematic analysis, Brown and Clark, and getting to the heart and creating an audit trail of every statement that's made in an interview and using that to build up a theme and a finding and a theory, a social theory. We're not so interested in that. And because we're not trying to build theory, but rather what we're trying to do is design something, it's important to get everyone's insights together. So what we do when we're trying to analyze qualitatively is we've all taken down notes as we've been observing different, we've been taking down notes as we've been observing different, interactions. And so from those notes, we make sticky notes. We use virtual whiteboards, especially this one called Miro. And just take you through it. What the sticky notes allow us to do is to break down our observations into separate chunks. And because it's on a board, you can move that chunk close to another chunk. So someone has made an observation about something and has come up with an insight, and someone else on the team has also made the same observation. You can then move them together. So that is the observations and the experience that we see, we individually analyze them and break them down. And then we, as a group, we put them together, we synthesize them and put them together into similar groups of chunks. That's basically the idea. You analyze, you break it down into sticky notes, and you synthesize, you group them together. So this is from a couple of months ago. We were testing the interaction between a large language model-based clinical decision support system and some primary care junior doctors. And so each of us put down our notes about the different, from the different tests. And that was the first step, analysis, putting down what we felt, breaking down the experience. And then we started to put them together into common themes, common observations, into insights. And obviously, I can't go into taking you through this. It's a team effort. So you might say that, okay, it's very subjective, it's very this, it's very that. The way to deal with that is to get more than one person involved. So it's as you have more people doing it, and more people who directly observe the same thing that you observed, then that increases its validity. And it's yeah. So you start to assemble things together, and then by the end of it, what we're doing is we are coming up with insights. But the important thing about designing something like this is not just to come up with the insight, but then to come to a design decision. So these are some of the insights, and the green stickies are basically things that we've decided that we want to change in the interface. Okay. So the idea is that design inquiry is inquiry for action, followed by action. So the user test doesn't end with a nice list of findings. It ends with optimizations to the design that you thought of. So in a sense, you are still very much not just someone who's inquiring, but someone who's designing. This is another way that we analyze some of our data, especially from that search modality thing. What we try to do, you can use flow diagrams as well to chart a person's navigation through an interface. And again, we wanted to find out when a person is searching for a patient's medical record, do they search by name, mobile number, the hospital number, this number, that number in this context? And so we just noted down the journey that they took. And what we noticed is that everyone finally ends up at mobile number, and that's the one that works. So if they searched for name and they didn't get the right patient, they tried again. We'd look at what the second search type would be, and maybe the third search type. And so for us, we realized that, okay, name is nice, but it usually doesn't work. Filters are good, but finally people end up mobile number. And so we had to prioritize that in our design. Okay, so I'd just like to end with this. Design inquiry is inquiry for action, followed by action. So like I said, based on what we found, we then had to go to the prototype designers and the product managers and say, we need to take this out, we need to add this in, that kind of thing. Okay, I've given you some, my time is up. We have a sheet in front of you that you don't have time to do right now, but I'd like to encourage you to take this for homework. I'm sorry I made it boring and very, just talking about. It would have been more fun to go into this exercise together, but just if you can try and think through this process. If you don't have a sheet, you can come to us. We have lots of sheets available. Is there anything else? Any questions? So anyone? Okay. Thank you.